This
if you will.
conference will now be
I'm gonna
recorded.
preface it a little bit the other day. Let's get this one going.
This conference will now be recorded.
It's been one of those. To me, this is supposed to be.
This conference will now be recorded.
Thank you. Thank you. Now, this is Shibu Kirakevlail. I'm the CEO, founder of Pacifyr. Good afternoon, everyone. Thanks for joining. Really appreciate all of your time.
Telling me it's recording, but
Manu, can you hear me properly?
Yeah, I can hear you, but I can hear others talking as well. I'm not sure if any other.
So I'll let Noel start the session. Noel, you can go ahead, please.
Oh, hello, everyone. My name is Noelle. I'm the account manager for Pacifyr. I'll start by showing everyone the agenda for the call. Just share my screen. Can everyone see the agenda?
Not yet.
I think now you may have to give us permission to share.
Yeah.
Can go ahead now.
Okay. Thank you. So first, I'll start by introducing the presenters for today. First, we have Shibu, our CEO and founder.
Shows recording. So, DRC says, apology, we are Pacifyr. I was mentioning to Shibu that offering on the platform, you'll hear much more. I don't want to steal his stuff.
Can everyone hear okay?
Yeah.
Yes? Okay. Sorry. So first, we have Shibu, our CEO and founder. So Shibu is a serial entrepreneur and has successfully built and sold 3 IT companies in the past. He has over 20 years of experience in IT industry with a focus in healthcare. He's also the director of NAS DAQ. Next, we have Dr. Larry Forrest, who is a gerontologist and entrepreneur. He has worked in the field of aging, disabilities, and mental health for over 35 years as a practitioner, academician, administrator, and researcher in the public, nonprofit, and private sector. Dr. Forrest is a licensed clinical social worker and a national board certified clinical hypnotherapist. He has a private practice with a solution-based focus, working with adults and family systems. Next, we have Madhu, our CTO. Madhu is also a serial entrepreneur and has over 20 years of experience as well in developing software applications and products. He founded Sino Technologies, a product innovation and services firm focusing on mobile and cloud app development. Prior to Sino, he co-founded LexaCloud, a cloud-based data management and analysis platform, and sold to Thermo Fisher Scientific. Lastly, we have Manu, who has over 20 years of experience in both finance and technology domains, covering software development and product management, payment services, personal finance solutions, and more. He has handled large projects involving multiple geographic locations. Now I'll give a quick briefing on what Pacifyr is. So Pacifyr is a holistic telehealth platform focusing on corporates to address the mental and physical wellness of employees. We provide confidential, non-judgmental, and stigma-free services with professionals who are therapists, social workers, life coaches, dietitians, trainers, and nutritionists. All right.
Doctor, if you're around, you can take over from here.
Absolutely. Everybody can hear me?
Yes.
Okay, good. Nice to meet everybody. My name is Larry Force. I've been working with Shabu and John for over a year now. As Noel said, I'm a gerontologist. I'm a professor of psychology, and I run an NIH-funded Center on Aging and Disability Policy. Typically, you would see me, but the reality is that we live in the Northeast. We're having a wonderful vacation for a month in Florida, only to be told you need to come back because you have a broken pipe. So we have a broken pipe in our house and everything is in disarray and people are trying to fix it as I'm speaking right now. We ended up about $25,000 worth of damage. So life happens, but here we are. And this is very good that we're here today. I'm very pleased to be associated with Pacifyr and with Shabu and John and Manu and everyone that's been involved. And Noel has done a great job in starting this conversation off. Noel, as I walk through this, you're going to have to switch the slides for me, okay? Does that work?
Shabu is the one sharing, but.
All right, Shabu, as I walk through this, you can switch the slides. Beautiful. All right, let's go back to the first one. So here's the reality. The reality is that digital mental health and wellness, it's not going to be in the future, it's here now. The thing that I found very attractive about Pacifyr is that it's a portal into complementary and holistic care. I love that. Even though I'm clinically and traditionally trained, I refer my clients to as many, I don't call it alternative, but I call it complementary approaches as we're trying to, address the needs of the whole person. When we talk about the issue of health, what is it? It's the absence of injury or illness, continually evolving state, best strategy for good health, making the right choice daily. As we were preparing for today, I get an email from a friend of mine that I teach with for 30 years now. He's freaked out because he has to go for a CAT scan. His life, which is pretty predictable, has now become somewhat unpredictable. So this whole idea of stress and healthcare, go hand in hand. What is preventative health? Preventative health, you can see it's, boost immunity, avoid illness. I mean, these conversations are very timely when we talk about, what the world is going through today. The idea of health screenings and being immunized and prevention of promotion and maintenance of health and well-being and wearables. I had asked a CEO on a project that I was involved in about 7 years ago, a CEO of a medical center, what's the hospital of the future look like? And he held up his iPhone and he said, it's not going to be the tall, 8, 9-story buildings, but it's going to be, healthcare is going to be delivered to you through mobile technology. And as I'm giving this presentation, I have an iPad, an iPhone, an iWatch. I'm all, appled out, as many of us are. And that's how we're, through wearables. What's holistic health? It's the focus on the whole body. I do not have anything against the use of psychiatry. However, I refer more of my clients to things like gyms, massage therapists, and yoga sessions, because I have a major belief and commitment to, if you want to change, then you really need to act like you do. And not all change occurs just by taking a medication or just by talking therapy. It has to be encompassing. Everyone, you have to be involved, your whole body. Why overall health is important? As you go down to the next slide, you can see what the numbers look like. They're staggering. Not only the amounts of money, over trillions of dollars on healthcare, but 90% of this total arises from chronic physical and mental health conditions. My focus in my practice is in adult development, and I do a lot in the area of the psychology of death and dying. And I create a course and I present a course in that every year. And you know that at the end stage of life, you know, the flooding, the impact, not only of stress, but of the financial commitment. You can see that on the top, statement there that 6 out of every 10 adults in the United States have a chronic health disease. As we move down, this is a no-brainer. Look around. The impact of obesity, especially in this particular, climate and culture. High cholesterol, stress-related issues, sleep deprivation. These are all things that impact, stress. Another project that I'm involved in, we had all this scientific, technology and verbiage, and we boiled it down to one statement. Got stress, we can help. And I think that applies quite clearly to Pacifyr as well. I love the fact that it's confidential. I love the fact that it's portable. I love the fact that it's available at a moment's notice. In my practice, I have a number of police that I see, but no one is coming in. They don't want to be on the radar. They don't want to go to, EAP. They don't want to go to their supervisor. They don't want to go to their insurance company because they're concerned about the confidentiality and the paper trail that will, provide in having them being able to maintain access to their guns and access to their badges. So this idea of being able to deliver, individually, confidentially, I think we're at the right time at the right place. I've said this as an aside, and I'm going to say it over and over again. When I first ended up meeting John and Shibu, my take was that I really feel as though that I'm in the garage with Steve Jobs, and he holds something up and says, "I think I have an idea." And that's where I am in my commitment to both Shibu and John and Pacifyr. They have an idea that's been tested, that's out there, and they're at the right place at the right time. You can see that as we start to talk about steps to achieve overall health, appointments, follow the plan, establish a plan of action. I have a number of people that when they go for referrals, they're told come back in 6 weeks. My wife in particular has a doctor's appointment next week that she made with a doctor, and the delay was 1 year. It's for a regular physical overview, nothing that's challenging, but this is crazy. As you look at the lack of availability, you can see what that looks like. The number of psychiatrists, psychologists, and social workers per 100,000 people in the United States. There's a gap in identifying symptoms and starting treatment. I am not a mechanic, but I know that if in my car, if something's wrong, I'm the first one to know that, and then I have to take it to a mechanic to find out what it is. The same thing with my body. I am the first one that knows that something's not right, but I'm not an MD, and the fact as a result of that, I then need to go and access, some type of physical assessment to find out what's right. This idea of stigma, even though we've come a long way, there is still this idea of stigma associated with therapy. And also that has a cultural impact as well. In certain cultures, the idea of stigma of therapy intervention is considered to be a weakness. And I think one of the things that Pacifyr does nicely is it levels the playing field. The idea of return on investment, John and Shibu will talk to that. But the fact is that I have students that are graduating now. What do I tell them? They are absolutely foolish if they do not look steady and hard at how to go about establishing a practice on a virtual platform. It's not the wave of the future. It's here now. You can see the role of Pacifyr anytime, anywhere, on demand, balance and demand the supply equation of mental wellness. And that's one of the things I want to be very clear about. We're not talking about mental illness. We're talking about mental wellness. It's anonymous, and it's easy viewing dashboards, not only for the client, but also for the practitioner. Go ahead. Pacifyr's role in the overall health of employees, continuous engagement, easy referrals, and integrated payment platforms. You almost, and this is the thing that people do not understand unless they go into practice. We're one of the few entities. You go to an MD, you receive the medical information from the MD, but then you go out into the waiting room and then you deal with the administrative part for billing. In our field, it's not like that. We're one of the few fields where we're actually delivering the helping intervention, and then we're also involved in, managing the currency and the payment. And Pacifyr has done a great job of simplifying that, making it seamless and making it clean and direct.
Thank you, Doctor. Appreciate it. So let me now take over and walk through the Pacifyr presentation. But before that, I would like to run a quick 1.5 minute demo video about what Pacifyr does.
Are you suffering from stress?
No, Noel, can you hear me?
Yes.
Okay.
Yes, yes.
Anxiety disorder, addiction, diet or wellness issues? With Pacifyr, everyone can have a timely and affordable multi-channel access to a complete and holistic approach of emotional and mental wellness. Here's all that you have to do. Download Pacifyr for Clients app from your mobile app store or Play Store. Open the app and click Sign In and follow the verification prompts. Do a self-assessment to determine your current mood and the reason why you're calling. Select from among several emotional, mental health, or wellness providers and connect with them via chat, phone call, or video call. There's an after session to understand how you're feeling after your session and then rate the provider. With Pacifyr, your well-being is the priority.
Okay. Thank you for listening. So let me now walk through our presentation. So the vision of Pacifyr when we incorporated the company is to create a globally healthy employee community free from the lifestyle diseases, and further it could save lives. So currently we are working at multiple geographies, and we onboard various corporates and employers to connect their employees. And this is, as you have heard, it's through mobile device, and the employees can connect according to their convenience anytime, anywhere with various providers in order to attain the holistic health, nothing but the emotional, mental, and the physical wellness. As you have heard from Noel and heard from the video demo, so we have two components. One, our holistic telehealth platform, which the employees can utilize in order to address their emotional, mental health, and physical wellness. And the other component of Pacifyr is nothing but a marketplace where we onboard various providers, which include licensed clinical providers, therapists, nutritionists, dietitians, career counselors, yoga instructors, so that these providers, according to their flexibility, convenience, they can build the practice through our platform and provide it as a secure HIPAA compliant telehealth platform. And currently this is being used by various employees, students from various users, which are from various domains. It could be technology industry, it could be the healthcare industry. From various domains, these corporates and employees are currently using our platform. So Manu will get to the details of how it works. Manu will be doing a demo a little later. So why Pacifyr, right? You may be wondering, there are other telehealth platforms and there are some other mental health counseling apps or platforms, but what brings Pacifyr in its uniqueness, and how we differentiate, right? So most of the other platforms you have seen are mainly focused on the therapeutic aspect, meaning you have to have some mental health challenges or a problem from a treatment perspective, connect with the therapist or psychologist and undergo the treatment. Even though our platform supports that, but our focus is mostly to inculcate the preventiveness within the employees. You might have heard that 42% of the lifestyle related diseases actually can be prevented, like hypertension, diabetes, and so on and so forth, if addressed at a very early stage. So our how, one area how we differ is by bringing this preventive aspect in our platform by bringing various self-help programs, videos, podcasts, resources from all these providers who bring into our platform. So not just from the session or the therapy service, but also this is a continuous engaging and ongoing aspect which the employees can take advantage of. The second, the key aspect, as Dr. earlier mentioned, the ratio of the people who can avail to the providers. So what happens, still through any historical use of EAP or such platforms, in order to schedule an appointment with a provider, it still takes week to 10 days to connect. Whereas through Pacifyr platform, even though we have appointment scheduling feature, but most of the providers we onboard, there is an on-demand facility which we provide, meaning the employees can connect to the providers instantaneously, whoever these providers keep themselves available and online. So that on-demand feature, especially people who undergo stress, road rage, domestic challenges, it cannot wait, right? It has to be addressed instantaneously or need to be addressed immediately. So that's another aspect which we have covered in our platform. And the third but most important thing about our platform is compared to rest of the telehealth platforms, we provide various analytics capability and a dashboard to all the stakeholders within the platform, whether it is employees or whether it is providers or even for the corporates, so that the employees, they know the progress, they get motivated and continuously engage on the platform. We all know traditional platforms, EAP platforms, hardly have 8 to 10% utilization, right? But through our platforms, at least 35 to 40% engagement and utilization through all these aspects what we do. And more importantly, the employers also can take corrective actions depending on all the feedback and analysis what they get through the platform dashboards. Obviously, we keep the employee data anonymous, right? So I went into little deep because we are covering some of these aspects in the coming slides. So the platform program what we offer is the holistic wellness program, and definitely that's something to create healthy and well employees, and to assist them in resolving various mental health and emotional health challenges. Some of these key areas, family issues, health issues, work-related issues, and whether it is related with the smoking cessation or weight loss program, such coping with any grief or loss, especially this pandemic. COVID has created a pandemic in pandemic scenario, right? So people undergo, remote working, work from home, and various challenges. So this would be a right platform to avail all these services. And from an employer perspective, the managers, they will be able to understand the challenge going through. They can get productivity up, reduce attrition, and bring up the morale of workers, and proactively solve various work-related issues, and so on and so forth. And this is the metrics which I've been talking about with the support from employers. Definitely we are able to showcase various metrics so that they can take corrective actions, or they can suggest us to include whatever additional services based on this. And how do we do continuous engagement? We bring in various webinars, we bring in various providers to talk about various aspects what the employees undergo. I think to some extent Madhu will cover some of those aspects. And we have nationwide network of providers. We partner with the various provider organizations, social worker associations. To give you one example, we partnered with the North Carolina licensed clinical providers. So that's how we scale our provider or from our supply side and connect with various providers. I think I have covered most of this. Again, to capture the uniqueness by bringing holistic program, not just the emotional or mental health challenges, but covering the whole 9 yards of emotional, mental health, and physical wellness, and bringing a flexible care model depending on the size of the corporate, depending on whether they have insurance or self-insured. We can work with the corporates. And the business model what we follow, it could be per employee per month subscription fee per an additional utilization fee which we charge, which again depends on the size of the corporate which we work with. So that the remaining areas, I mean, we are fortunate enough to have a great team members and advisors on our board. So I will let Madhu take over from here, but I wanted to pause before Madhu takes over. Any questions anybody has, please feel free to bring it up to chat, or you can raise it at this moment before we proceed with the walking through the platform.
So Shibu, this is Nova. I don't see any questions in the chat, but I think my apologies for not introducing it well enough to say put this question in the chat. But if anyone has any questions, please. I see oral. Thank you very much. So if the employees are connected through the employer, how do you ensure confidentiality? How do you convince employees of the same? That's always a problem when you're trying to keep somewhat anonymous.
Yeah, thank you. Very great question. So when we provide the dashboard to the employees, we make sure that there is no name associated with the usage or the utilization. So the employers would only see in the dashboard how many calls happened and what is this regarding, whether it is associated with the stress or smoking cessation or weight loss or anything of that sort, right? So from that aspect, when we onboard the employees, we do the demo, we showcase our dashboards and platforms to make sure that the information is not being passed and kept at anonymity.
And Shivu, this is Nov again. As you're growing the platform, are you finding any sense of expanding the kind of healthcare capabilities you have? Are you seeking further partners in the healthcare world? I know that you and I spoke a little bit. Certainly, everybody being certified and such is a very important part of that, so that you're really knowing that you're getting the best care possible. But what I like about the platform, as you said, I can call and there's somebody available to me. And I think, as you said, problems don't seem to crop up just in the day or the night or whatever. They crop up all the time. So the accessibility is probably one of the key things I'm hearing.
Absolutely no. So that's why, rather than bringing the providers individually, I mean, through our platform, anybody, any provider can register, but in order to onboard them, there is a stringent process which we go through from our end, right? There are internal employee who runs through their background, make sure they have all the certifications and license needed for the corresponding state. and that's the only way we onboard them. But more importantly, we partner with the various national associations or bodies, like I mentioned, right? The LPCNC, they have thousands of providers. So there is already a vetting process which has, which the association has done at their level to onboard them as their members. And when we partner with them and we do another round of checking to make sure that they are licensed and having the experience what we are looking for. So that's a stringent onboarding process we follow now.
And then one very last question, which you may have mentioned before, but I may have missed it, and that is there kind of a sweet spot in terms of the platform usage? In other words, is this adoptable? I don't see any constraint, but let me ask it more formally for you from a marketing standpoint. Is it adoptable by almost any size company, or is there maybe transactional volume or something like that might be dictating a larger versus a smaller company?
Yeah, very great aspect which you brought in. So the beauty of our platform is, right, we don't have any challenge in terms of onboarding, say 5 to 10 employee based employer, or even bigger companies with hundreds of employees. Our sweet spot obviously is a small medium, because that's where they have some insurance challenges. Some of them are self-insured, or they have challenges in terms of increasing their budget or healthcare cost, where we bring in various flexible economic models to address their needs. And to give you a perspective, we have MHA, the Mental Health America, one of the company, one of their MHA in Dutchess County, New York. They have more than 240, 250 employees, which we provide service. And so I mean, even from 5 to 10 employees onwards to bigger pool, we will be able to serve now.
Great, thank you very much.
Okay, very good. So anyone else have any questions? So please keep it on the chat. So Madhu, can you please take over?
Just a very quick one that came in from Dennis. You and I spoke a little bit about the fact that assuming that you have HIPAA compliance in the US, where's the actual data residing? In client server architecture, the data warehouse, roadmap for decentralization, etc.?
Yeah, so in fact, Madhu is gonna address some of the aspects of security, compliance, data privacy, and talk a little bit about our architecture before we move on to the product demo. Is that okay?
Oh, absolutely. Thank you.
Yeah, Madhu.
Yeah, thank you, Shibu. Good afternoon, everyone. So I'm going to talk a little bit about the platform, the architecture. Can you see my slide? My screen?
Now we see it, yes.
Okay, all right. Yeah, so I'm going to talk a little bit about the platform, the architecture, touch on security, and then cover how you can get started, the process for getting started on the Pacifyr platform. So after that, Manu is going to do a demo. So this is how it looks, the platform. So in the middle, you are seeing our the core platform aspect. Then users, individual users or employees connect with the platform, and then avail services from counselors. And as Shibu mentioned, counselors could be any of the providers servicing or providing the holistic wellness services, or it could be even doctors providing the services. And then we take all that data in, do analytics, and then provide that back to stakeholders like employers such as yourselves, right? So you can see what's going on, how you can improve your organization in terms of supporting your employees, or it could be consumed by other entities as well, such as insurance providers or others who are interested in the data from the platform. Of course, we provide everything anonymously, so we are not sharing any specific individuals' data. And then we also can connect to other devices and pull data in, and then provide that complete view to the user. So that's a platform. The whole idea is that to create a very flexible and expandable platform so that we can plug in more and more things as new things become available. And this is how the architecture looks. So, I mean, just suffice it to say that it's a very secure platform. The data resides in the US, and then when we provide data outside the US, then we have a different deployment there. For example, we have clients in India. So then we store the data for India within India and the data for US within the US. And it's highly secure, deployed on Amazon Web Services, encrypted. So you don't have to worry about data security and data getting out or anything like that. And then we are also in the process of completing the SOC to SOC 2 and HIPAA certification through a company named Vanta. So we do have everything in place, but we just need to get the certification so that we can show everybody that we are certified and compliant. So that's a process, it's in progress as well. So now that you have the platform, you understand what it is, and you want to get started. The first step, of course, is us working with you to really understand your needs and then onboarding you from a sales perspective. So that's a step number one that you're seeing on the left. So number two is once everything is agreed on, we bring your employees onto the platform. So typically what companies do is they give us a list of their employees with their phone numbers and emails, and we import that data into our platform. And employees get an invitation by SMS and or email, and then they can just click on the link and download the app. So that's very straightforward process. Anyone can just do it without training. Just click on the link, download. And once that is done, so we have various programs to support the employees. So we do webinars. We also have a pre-assessment questionnaire that we give to employees. And that can be customized based on your needs, based on your type of employees, the location, the type of job. We can customize that survey and send it out to employees and gather that information so that we know exactly what they need, where the gaps are. And based on that, we can provide additional seminars or one-on-one sessions to employees, right? So the idea is that we are not just opening the program and giving it to them and let them decide what they want to do. We can guide them as needed. But if they want to do it on their own, they can do it as well. Anytime they can do a one-on-one session with any other provider on the platform. So just to show you how that looks, that pre-assessment. So this is how it looks once we do it. So you can see how people are responding, but you're not seeing any names of the people, right? Overall, you're seeing where the issues are, what people are thinking, how employees are feeling. Are they feeling healthy? Are they sleeping well? How are they doing in their relationship? Are they stressed? So these are some of the pre-created questions that we have, but we can add more to the survey and then send it out to the employees. And once we get that data, you can see this on the dashboard. You get an idea exactly how employees are doing. And then based on that, we can take the next steps. So in some cases, we may need a webinar session to address a certain topic, or in some cases, it may be focusing on some resources. I mean, pointing employees to certain videos or documents they can read within the platform, right? So it's completely customizable. The approach is customizable based on your needs. And then once the program is up and running, you can always see continuously what's going on in the program through the dashboard that I was just showing. And then if needed, we can do more assessments. Maybe we do an assessment every 6 months or every 1 year, again, depending on what you need. So that's how the program works. It's pretty straightforward. The app is very simple, so once it's there, people can start using it. If they have used Uber or any of those consumer apps, then they can also use Pacifyr. So these are some of the questions that we had that I just showed you in the dashboard. So this is how it looks, the survey, right? I mean, the pre-assessment survey. This is what they see, pretty easy to answer. And then this is how the dashboard looks once we collect all that data. Yeah, so that's basically what I wanted to cover. Just wanted to give you a quick idea about what the platform is, how it's designed, and then what the process is for getting you on board. And then without further delay, I want to make sure that we leave some time for the actual demo as well. But if you have any questions regarding security or the platform, I would be happy to take those right now and answer those.
Yep, thank you, Madhu. Really appreciate it. Now, can you please give sharing access to Manu, because Manu is gonna do the product demo.
I have it, I guess.
Yeah,
okay.
yeah, you can just go up there and ask for that to share by hitting the screen. But let's see how that works. Yeah,
Okay.
it's here.
All right. Thank you.
Great. Thank you.
All right. Yeah. Good afternoon, everyone. So I'll be taking you through the actual app. Shibu has given the business side of it up there, the presentation on the business side of it, and Madhu has taken us through the the architecture of the platform. Now this is how the app really looks like. So there are two parts. I mean, actually there are three parts. So one is that every provider has an app, and then there is every client has an app, and then there is a backend, which Madhu talked about, the platform which stores the data and then where all the processing happens. Those are the three pieces, and it all comes together to deliver the experience for the clients and the providers. So this is how the platform is. So unfortunately, I don't have the side by side there. That's how I usually do it. The second device is not cooperating, but I can showcase with the same device itself. So what you're seeing here, so this is what you're seeing here is a provider app. So this is what a provider would see when they come into the platform. So there is a way to onboard a provider. So that onboarding process, we have two methods. One is that we do it through the backend, which is where we onboard in bulk the providers by onboarding, let's say an association or a providers clinic, all the providers in a clinic, etc. So that is the the bulk onboarding where we do it from at our end. This is the first one, and the second is the individual providers who comes in and then onboards. For them, there is a registration workflow. They can come in, express interest, they go through a vetting process, and then they get onboarded. And once they are onboarded, they get into an app like this. And this is the the green button here is the on-demand button that Shibu was talking about, where it is not just scheduled programs, but it also covers on-demand. So there's a question about whether we store any audio or video. We do not do that. So that's completely encrypted, and it is between the provider and the client. We do not have access, even it's not stored anywhere. So what happens here is that provider has a landing page, a dashboard, where a basic set of information gets shown up. So one is that because it is a interactive application, there's a session rating that happens. So why that happens is that once you start engaging with your clients, a provider starts engaging with the clients, and the client starts engaging with the provider, there is a two-way rating that happens. So there's a rating of the session that happens, and there's a lot of other intelligence that is built in to ensure that the matching of the right provider to the right client happens. So all of that analytics happens through all these ratings and basically what we call as the effectiveness of the intervention or the session. So that determines a lot of future discovery and the connections. Then of course, each provider may be interested in knowing their earnings. They can take a look at their clients, etc. And then there are a bunch of menu options where you can go and see your past sessions. So I'll showcase some of them. I'm clicking on my sessions where I can go back and see all my past sessions. What happened. I can scroll all the way through all my past sessions. I can click on it. I can see what the session I had, and I can check my session notes, the prescriptions, and then there is a questionnaire that we pop up at the beginning of the session and at the end of the session that captures the emotion, that we call as the emotion map from the client side. So that also gets captured here, and obviously some quality information also. So that's about the session. Then there is of course the appointment feature. If you don't want to have on-demand session, you can always schedule a session, and the appointment workflow is there. And then messaging. So there are three ways of connecting. There is a video chat or video call, audio call, or you can chat. So 3 methods of connecting. So this is on the provider side. Any questions? I'll pause and take questions. If there are any questions on the provider side, the high-level features, I'll showcase an actual call, but before that, if there are any questions, I'll take now.
So Manu, this is Nov again. I always have questions. My apologies. But so knowing that you're talking about the provider side, but I'm kind of curious. So I can see my sessions, I can see my patients, and so on. How would I be able to change who is going to be my, physician, or however you want to call it, if I don't like maybe there's no synergy between myself and this particular person, so I want to change. So number one, I'd like to see how that happens. In other words, I just put myself back out there. And secondly, what about the sessions that I've had? Is that now transferable as my files to whomever I'm now seeing? Is there any value in that? I don't know enough about the process to say, is there value for that for somebody else who's going to be speaking to me, but I'm curious.
Yeah, so from a client side, we completely give the choice to the client to choose the provider. So we do not intervene, except that there is an intelligence to match the right kind of provider. Just to give an example, if a certain provider is providing better intervention or better outcomes for a certain demography of clients, then when such a client comes in, we might do a better matching to those sort of providers. So that is the only thing that we do. Otherwise, it's completely up. I'll show the client side in terms of how they discover and what choice do they have in terms of choosing, right? So if you don't like a provider, you can always change. So that is completely up to the client. Now, the session information is actually between that provider and that particular client. So at this point, it is not transferable until and unless there is a consent that we can get explicitly on transferring of those records. Gotcha. So at this point, it is not transferable.
Gotcha. Thank you. I think that's pretty much it. Oh, I'm sorry. There was a question from Dennis over here about the fact of internet, kind of an internet of everything type of consideration. That I'm on my phone, I've got the weather app, it's picking up all the perspective of my environment while I'm speaking to you. Is that part of your world? Is it, I want to say, in all honesty, Dennis is a very bright gentleman, so he asked some very, very down the road questions. I'm just curious, is that meaningful when I'm talking to somebody about where I am and what I'm experiencing in the environment that may have a great deal of bearing on what I'm saying, if you will, my mental state, if you will.
Yeah, so we don't do that. I mean, as Madhu said, there is an ability to collect all that information from various sources. But today, what we do, so I've just shifted to the client app. So I'll showcase what is that we do today. So this is the client app. So in the client app, we have different ways of connecting, right? So there is something called as connect to provider. I have a connect button here. Then in the menu, I have something called as a, browse providers. There are different ways of connecting. So let's say I selected browse providers, right? So we show up a bunch of specializations, right? Which are grouped according to the standard, specialties that are there for mental and emotional health and physical wellness also. So this is what it is, right? So if you select on nutrition, then a bunch of nutritionists will appear, and you can click on any one of them and you can see their detailed bio. So this is how we give the choice to the client, right? So they can take an informed decision looking at their billing rate. So this is like $40, and then what's the area of specialization. So you can go through all that and then decide before connecting, right? So this is the first one. And when we actually do a connecting, let me just showcase a connecting so that that becomes clear. So this is the emotional or the emotion map emotional map that we build, right? So we ask it's a 4-step process of asking questions to find out, right? If somebody says that they are, so even if you're feeling good, for self-improvement, you can actually connect, right? So let's say you're feeling good and you're feeling, let's say, inspired, and you want to, contact somebody for self-improvement, and this is a provider I have set up on my second device. So just wanted to showcase, right? So here now you have multiple ways of connecting. So you can see that there is video, there is audio, then there is chat, and the fourth one is the scheduling. So there's a calendar icon, and you can always schedule for a later date, and it gives you so if the provider has set up time slots, you can actually go pick up that time slot and then book the time, right? So these are the options. So let me just make a connect, right? So you have seen that we have collected the emotional information, which is basically a set of questions that we ask the client. Now we can consume additional information in terms of, are you in a place where it is humid, where it is, cold? And if you believe that, that's an additional information that would help in the intervention, that is doable, but we don't do that today.
Gotcha.
Right. So this, yeah. Yeah, go ahead, please.
Okay, again, like I say, when I'm seeing a platform like this, it generates a lot of questions. So what I see an awful lot these days, and you have yoga and a meditation class and so on, this idea of a kind of a community, i.e. I've got an instructor that's on the other end with a community of people who are in, I won't call it competition, but in concert with one another, trying, in a sense, working with the instructor, working as a group, doing what. Is that meaningful for this platform, and are you looking at that as a possibility? Kind of like call it group therapy type situation.
Got it. Yeah. So there are some confidentiality issues, especially in the mental and emotional health area for handling such group sessions online. So we are not in that, but on the physical wellness part, there are requirements that has come in that, but I don't think in the emotional and mental wellness space we will get into that because of the the confidentiality issues. However, we have a resources section where we are actually delivering programs which the clients can consume, right? The providers are free to post their programs. Dr. Larry can explain it. His programs are already there, and that's something which I will showcase. I'll just go through this call and then showcase that that part as well.
Sure. Thank you very much.
Right. So this is an on-demand call I am demonstrating. So I can just click on start the call, and the moment I start the call, I have the second device set up on the side, and you have waiting. So it's actually ringing on my other device, and my provider accepts it, and then I am in the call, right? So this is the place where now you get into a call and you exchange pleasantries with the provider, and once you have established that this is the right call to make, so at this point you have various options here, right? So you can see the menu on top, you can see all your past information. So exactly like this, the provider also can see the past information of all the sessions, right? So you can go and see, okay, this was my last session and what was the prescription. So all of that, right? You can open up the prescription and then see, okay, what was the prescription that was given during that session. All of that is possible in the context of the call. And then you can chat, or all of that can happen. And once the connection is established, the provider will start the session. So I'm clicking on start session, and you can see that there's a session started. And and this is the time when the billing is starting. So once the session starts, your billing has started, and then you can see the timer going. And at this point, provider can make their session notes, which is not visible to the client. That's a private note of the provider, but the provider can enter a prescription, right? So I'm just entering a prescription. So after entering the prescription, the provider can tell the client that, okay, I've entered a prescription. Do you want to take a look at it and ask any questions? So right now on the menu, there is a prescription. So this is, you can see that there is something called as my prescription, which is just the one which I added just now. And if you have any questions, you can ask. So all of this is very, very interactive, right? You can talk, you can, update the prescription and send it across to the client. They can look at it, ask questions, and then at the end of the session, the prescription get frozen because, of compliance reasons, right? You don't want to tamper with the prescription once it is frozen. So that's what happens. So I'm going to end the session, and I'll showcase how the end of session happens. So once you end the session, you get your bill. So this is the bill summary. You get an email as well, bill in an email. And then you get a session summary form. And this is what I was referring to, right? It goes through a rating process. So you rate the therapist, you rate, you initially, when you started the call, you declared your emotional state. And how are you feeling at the end of it, you need to declare. And call quality and all of that, right? So once you submit it, it appears in your my sessions. I can go and see, so this is the last session what I had. So this is how the session workflow. And just to quickly touch upon the the resources that we talked about, right? So this is what how programs are delivered. So it's not exactly like a group therapy, but these are all programs and videos that are hosted by various providers, and that gets delivered as part of the program. So when a corporate onboards, right, they can pick and choose their interested areas, or they can say, okay, whatever is your top programs, we would start showing up to our employees. So all of those customizations are possible.
Perfect. So if you don't mind, Manuel, let me mention to the Technology Review Council audience. So we are past the hour, and again, that was my fault to start so late. If you don't mind, I'm going to keep the session going for a while until Manu and others can finish their presentation. You're welcome to stay. But again, we have this recorded, so as a result of that, it'll be out in the link if you want to catch the tail end of this. But again, thank you all very, very much. Manu, please continue if you don't mind.
Yeah, thank you all whoever is leaving. Yeah, so I think that's pretty much the demo in terms of the basic workflow. Yeah. Any other dimensions you want me to cover, Shibu, or this is...
No, that's great, Manu. So thank you for covering how does it look from an employee perspective as well as from provider perspective. So it really helps. So great. So anybody else have any other questions? Please feel free to go ahead. But I just wanted to summarize this. Especially these days, we see a growing challenge in terms of employees are struggling because of the remote work and because of various challenges at home and the stress at work, especially when we are talking about the first responders and healthcare workers. It's a real challenge. So if our platform can address at least some of the struggles they go through, especially if handling their stress, making sure that it is at their ease, availability, based on their convenience, anywhere, anytime they can avail the service, and with an instantaneous capability to connect with a provider to address their challenges. I think this is going to be a great opportunity. And also we all know that the healthcare cost, which is every year, it is a challenge for the employers to do the insurance renewal because the premium is going up. But the one of the other aspect which we can showcase is to the insurance companies by showcasing how the employees are remaining healthy and well, so that insurance companies also can reduce the premium next time when we go for the renewal. So from that perspective, for employers also, this is a great opportunity to have the platform and take it further. So that's all from my side. Again, thanks. No, really appreciate you connecting this.
Well, thank you very much for the presentation. Let me check and see if there are any other questions out there to the audience. We're down to a bit of a smaller crowd, and I apologize that we went over the time, but that was my fault. But I'll make sure that when we send the link out, that everybody has a chance to go out and look at it. I did have a couple of I'll call it lingering questions. So as employers are looking to provide healthcare platforms that are a lot more open, if you will, we're seeing not necessarily a similar situation for you, but let's say there's another healthcare platform that offers another type of perspective. What, as an employer, what would I need to consider, or can I have both your platforms sitting there, and can I have some kind of a single sign-on to it? Or, in other words, I don't want to confuse my employees to have to go to several different platforms to get what they need. So how are you architected in such a way that maybe a single sign-on would allow me to get to your platform if I'm doing mental, if I'm doing yoga, or I'm doing nutrition, or I'm doing something completely different, or whatever the case may be? You're going to find, we're finding in the cloud world that we're getting multiple solutions for similar things. That's probably the best way to put it.
Yeah, that's a great point you brought up now. In fact, Madhu, if you are, Madhu is here. Madhu can talk a little bit about some of the other clients, how we doing the seamless integration. Madhu, especially that Mother's app and the worksite labs, you can just mention that. But the point is, now obviously the platform has that capability to connect with other integrate with the other platforms, so that there is a seamless service through either through single sign-on or through other technical options. So Madhu, you wanted to just give those a couple of scenarios how we have handled.
Sure. So there are multiple ways of doing it. So one is, so let's say there's an existing system already, and then Pacifyr is coming in. We could build a connector. So the architecture is pretty open and flexible. So the connector can enable a single sign-on scenario. So if the employee is already logged into one system, the same can be used to log into Pacifyr as well. The other scenario is our system can plug into other systems. So that's what we did with one of the customers. So we provided this as a component that can sit inside a larger environment, a larger ecosystem. And then when employees access the system, so this appears as a solution or as a service that's available to them within that overall environment. And then one customer has done API integration, so we provided an API, which is another way of integrating. And then they used our API to connect to our system. So there are different ways of handling it based on what the customer has. And we can absolutely work with you and enable that integration so that it's seamless rather than they need to sign into multiple places and access different systems.
Great, great.
Yeah, Madhu, also I saw that in the chat, someone asked, I think the Dennis left, but you wanted to address that, the storing in our cloud, whether internally or externally.
Yeah, so audio and video conversations, the chat conversations are stored. So that's in the cloud because you need to see the chat history. But we don't really store the audio and video conversations of between the provider and the employee,
Right.
either on the device or on the cloud.
Yeah. That would be problematic as your storage needs expand beyond belief.
Yeah, right.
And the question becomes, is it really worthwhile? So are you expecting at some point in time, though, along the same lines of the storing of the conversations, many products like this GoToMeeting, Zoom, Teams, whatever, providing transcripts? Is that something that can and potentially would be useful to maybe even transferring a case from one person to another?
Yeah, so that's definitely something that we are going to look into. Again, optional, right? As if the provider and the employee or the user agrees,
right,
then we can enable that feature where we automatically provide a transcript of the conversation for future reference. Yeah.
And as you pointed out before, just the global aspects of what you've done here and the considerations of things like GDPR and if you will, privacy, et cetera, that you really can adapt extremely easily as a global platform for a global company. And I think that's, you know, I want to say that because that kind of makes it a very easy transition for an employer to consider, but it's not an easy transition for a lot of folks out there to be competing. So you've done an exceedingly nice job in providing this telehealth platform in a global sense. That's very cool.
All right, yeah, thank you.
I think that's about it. I don't see any further questions. I'll leave it open to a few minutes here or a few seconds. If there are any questions, please ask. If not, I want to say thank you to the Pacifyr world. You guys did an outstanding job as always. I'll make sure that this link goes out to the rest of the Technology Review Council that may not have been able to attend or those that had to leave early. And again, I'd ask you, as I've done before with other vendors, as you continue to improve, as you grow, we'd love to have you come back in, let's say, 6 months or 8 months down the road and talk to us again. It's always one of those things that, you know, you may have some statistics coming out of all this stuff as a post-COVID situation that might be very interesting in terms of the volume, the usage, et cetera. Things that would be indicative of the fact that we're all really kind of, you know, we don't want to admit it, but we're struggling with this process. This was not normal. So, we'd certainly invite you back at any point in time that you'd wish to come back. So,
sure. Absolutely. Thank you so much. No, really appreciate your time and thanks for organizing this. And thanks everyone else. Really appreciate. And especially for Manu and Madhu, it's early in the morning. I mean 1:30. So.
Oh yes. Oh my gosh, you're right. Thank you. Thank you.
3 o'clock in the morning. 3 in the morning.
One other thing really quickly, Shibu, and that is, and I'll put it here in the recording, that I know how to find you guys. So if anybody is interested in speaking to Pacifyr, please let me know. They would, I'm sure, welcome, at least if nothing else, a contact and a question. So
all right.
Look forward to it.
Absolutely. Yeah. Thank you so much, Noel. Thanks, Noel. Thanks, Doctor.
Thank you all. Thanks, Madhu and Manu. Thanks.
Bye, John.
Okay, thanks.
Okay.
Thank you all.
Thank you.
Bye. Bye, Noel. Bye. Bye, Shibu.